Okay, we're getting populated here. Great, good to see everyone. So we'll kick it off here in about a minute, Jordana. So all I'm chairing today, Marky is en route. She's in transit, so she may call in from the road, but she couldn't be here, so I'll be chairing the meeting today. I want to make sure I can hear. So far, I'm not hearing anything. And say something.
Oh, you want me to? Yeah. Hi.
Thank you. I hear you. Okay,
Hi, Greg.
Good. I just want to make sure that my audio was working. Otherwise, I'll be talking.
Well, we hear you for sure.
Okay, great. Okay, the question is, do we have enough people here to begin? I see. Let's see, who do I have? I'm looking for our, I guess, Bill, are you, if Marky's not here, you're the man. You'll be the man next year, but you're the man sooner, I think, right now, if she's not here today, right? Is Tom Kurt here yet? I don't see him on the, and Brent's here. I see Brent, your name is there. Let me know if you can hear me, if you're on. Tori's here. Linda, I'm looking for names. I don't see Linda yet.
And Greg, we need 4 for a quorum.
We need 4. Okay, so that would be at this point that could be me, Bill, Tori,
And Brent.
Linda or Jeannie here.
And Brent could be.
And Brent's here. And Brent's here. Okay,
Yeah.
God, we're here. We actually have a quorum here, so I think I'm going to call us to order. We don't have a lot of time today, so I'm going to call it to order. I'm going to do the roll call now. So we'll start. Bill Madsen is here. Just want to make sure for the record if we need to record this. Brent Miller is here. I'll let you say here.
Yeah, I'm here. Sorry.
Okay. Tori. Tori's here. Linda or Jeannie. I see Jeannie. Okay. Jeannie is here. And looking down my list, is Linda Vieira here? Apparently not, but we have a quorum. Okay, and some alternates are here. We have staff and visitors today. Reviewing the agenda, are there any additions we need to make to the agenda, Jordana? Anything we need to add or change today?
The only thing on the agenda, Greg, is the 5-star program.
Right. Okay. So that'll be easy for me because I'm going to hand this over to you. We're here to discuss the 5-star program and if and how and when we would adopt it. So take it away, Jordana.
All right. Thanks, Greg. Lindsay or Raleigh, are you able to pull up some slides here? Thank you. So today, as Greg stated, we really want to walk through the 5-star program. We'll start by giving everybody a little bit of a, if you go to the next slide, and even one more, a little bit of a dial overview reminder before we dive into the details of the 5-star program. So if we look at this slide, we really are reminded that the state dial has placed us, or we are operating under the orange level restrictions associated with the state level dial. What we can see, if we look at the 3 measures that indicate our placement on the dial, is that our incidence rate is up over 1,000, which is well into the red level. That the cutoff is at 350 per 100,000. And our average positivity was higher earlier, but we, with all of the community testing that has been offered, have been able to really bring that down to around 6%, which allows us to feel like we have enough testing to really be able to monitor the incidence of COVID in the community. And then finally, our hospitalization rate is the third indicator that really places us in a level on the dial. And what we've shared before, and I'll just reiterate, is the hospitalization metric is based off of the number of Pitkin County residents. So anyone who has a Pitkin County address who is hospitalized as an inpatient, whether that be in Pitkin County or any other county. So if you have a Pitkin County address, you are a resident. If we have 3 Pitkin County residents hospitalized in one day, that is what puts us into the red. So just a little bit of an overview of the dial. And I think if we go to the next slide, if we really are thinking about this movement between levels, and what the more we've come to understand about it, is the movement from orange to red is what the state outlines for us. And what we've come to understand is that it's one metric needs to be in red for 14 days. Then we get that call from the state to say, let's chat about the metrics. What they have been working with us in practice is that we've been able to remain in orange because we were able to put in additional mitigation measures, our stronger orders in the public health, our stronger protective measures in the public health order. And we haven't had that second metric go into red while that incidence rate has been there for over a month. What we do understand from the state, though, is that according to the public health order, even just with one metric in red, they have the ability to move us into the red. So it is, a negotiation. We have demonstrated that by putting into these more protective measures, what we're calling Orange Plus, we have been allowed by the state to continue to operate in orange, which has much less capacity restrictions than what we would see in red. And then just to remind everyone that to move from orange back into yellow, all of our indicators would need to be in yellow or better for a 14-day period before we could apply to make a move that way. So this is going to be really helpful to understand as we get into the discussion around the 5-star program, because it affects our eligibility for the program and for the capacity restrictions, reduction in capacity restrictions that are associated with that. So I'm just going to pause here for a minute to see if there are any questions from the board about movement between levels.
Great, thanks, Jordana. Somebody, you might have to speak up if you're on board and you want to ask a question. I don't see everybody on my screen, and I'm going to shuffle around here and look for people. And I don't see a question coming yet, which is surprising.
Would there be a way that Aspen Valley Hospital could add a bed or two to intensive care, such as have 4 or 5 beds to increase that flexibility?
So no, this metric right here is, if your question, Dr. Kerr, is about the metrics that are set by the state, really don't even in this instance have to do with AVH's capacity. They have to do with a Pitkin County resident being admitted to as an inpatient, whether that's at a local hospital or a hospital in Grand Junction or a hospital on the Front Range. Any admission of a Pitkin County resident counts towards those new hospitalizations.
Great, good to know. Thanks, Marky. Any other hands up here? If I don't see you, you can just speak up as Kurt did, Tom did.
All right, we'll have more opportunities to chat. If we go to the next slide, we'll share some more data here. So when we look at state level data, you know, there was a really big effort made before the Thanksgiving holiday, both around messaging and policy, to try to counteract the bump that we all expected. And so what we see is that Colorado as a whole bent the curve. Our incidence rate in Colorado as a state is the lowest one there in red, and we see that the policy measures, which I'll talk about in a minute, as well as all of the marketing and social media and messaging that went out to really just associate with your household, we believe that worked. Other states really did see some bumps from the holiday season around Thanksgiving. Pennsylvania saw almost 50% increase in cases after Thanksgiving. Ohio had a huge bump. Illinois did see a decrease, but they also closed indoor dining and activities around the same time that many of the counties in Colorado went to that red level, which did close indoor dining as well as indoor events. So if we look at the next slide, we can see these policy changes that I talked about going into effect in November. And so one of those main policy changes was the move to red with the closure of indoor dining and indoor events. And what we see is that red has been effective in Colorado, in these counties who you can see when they implemented orange, and then with that red line, when they implemented red, all of these counties went in November 2nd, and then did see sustained declines in their incidence rate. If we look at the next slide, it shows some more counties that went into red and again saw that decline. And so, you know, what this data is saying is we're seeing that this red level on the dial works to decrease incidence rates. If we look to the next slide, we can see that the counties who went to orange mostly see some flattening, some plateaus, or growth in that incidence rate. And so Fremont is an anomaly here. There were some different things going on there, but for the most part, all of those counties who've been in orange have seen that continued increase. And if we go to the next slide, or maybe a leveling and a plateau. And this is where Pitkin County fits in. You know, even with our orange plus measures, we have continued to see elevated incidence growth since implementing those measures. And so I think this is really helpful for us to think about when we go into these discussions about how we go forward, knowing that you know, we still have a lot of visitors coming to our community. We have a lot of potential gathering that might be happening, and realizing that we are in a much more precarious place than we were back when we were having this conversation during Thanksgiving. So we go to the next slide. Kim, I think this might be an opportunity to turn this over to you, and Dave's available for questions as well, just to share the update that was made to the Aspen Valley Hospital matrix as well, to talk about what you're seeing in capacity there.
Thanks, Jordana. Can you hear me okay?
Yep, we can hear you.
Great.
Thanks.
Yeah, thank you,
Kim.
everyone. Yes, and Dave Ressler is available for questions if anyone has a specific question for him online. So this, I just want to take a minute or so, briefly present the hospital matrix has been changed as of this morning. The third level of essential healthcare workers out has increased now to the highest level of concerning in the red. And so we have a significant number of healthcare workers who are out now. There's been a steady increase since September, and we're at a high level up to 27. Combination of workers who have COVID-like symptoms and are on quarantine. And so what I believe is that this is really a reflection of what's happening in the community, the level of community spread, and how it's affecting everyone, including our healthcare workers. The hospital continues to operate fully, and it has full safety measures intact. But this change is concerning. And I also wanted to just quickly address Dr. Kurt's question that we do have surge planning in place, and Jordana did explain that it really is Pitt County residents, and we're kind of on in terms of them being hospitalized anywhere with the dial. And so if we have even 1 or 2 more hospitalizations, we may flip that dial into the red, having our second indicator. But really, I just wanted to take a moment just to give an extremely cautionary note at this point that we are in a precarious situation. The data that Jordana just presented really speaks for itself. It's very concerning and important data, looking at the red level and the effects of a red level on community spread and on the level of COVID in a community. We've been above 1,000 on our incidence rate since November 10th. We're at a very concerning point, and I think we have an opportunity to hopefully to change and pivot a little bit like some of these other counties have done. So this is a huge warning out to really be cautionary about relaxing anything and to consider steps towards tightening at this point. It's a critical juncture. I see a couple other notes besides the healthcare workers. I know the affidavit, I think, was a very important step in the right direction in terms of curbing incoming disease. And the public health team has done an incredible effort on that. And then also just a note about the vaccine, there's a huge buzz and a sense of hope that the vaccine has arrived. Today is the first day. It is being given out to a total of 100 healthcare workers, the frontline workers that have been selected at the hospital at the highest risk. And it's extremely exciting. My note of caution on this is that it's not an immediate solution, and it is a lot of promise and hope, but it's going to take months for this to roll out and get to a point into the population, the general population, although it is beginning now and it's really promising. But again, just a cautionary note. And then we also don't know after someone gets vaccinated, you still have to wear a mask and follow the 5 commitments. We don't have any understanding if they can still pick up, transmit the disease. And so it's going to, everyone who gets vaccinated is going to continue with the same precautions that everybody else is doing. So, and then just looking at this really simply on both a personal level and an organizational level, there really is a sense of huge responsibility at this point for everyone to continue doing what is now sounds like very old messaging of the 5 commitments, but they're simple and true. And then also on an organizational level for businesses to really comply with the public health order. I mean, every system is taxed right now, and no county can enforce this on every level. And we're really asking everybody to enforce it in yourself and be personally responsible on an organizational level and a personal level. And those were my quick comments, I think. And if there's any questions.
Kim, I have a question. If you could just clarify, I've been reading up on the vaccines, and I have not heard anybody say that there was any question that the vaccine is not going to keep us from social distancing, wearing masks until there is some high degree of immunity. So what I heard you say is that the jury's out. So that can you clarify that?
I don't know that to say the jury's out, but we don't have an understanding at this point. Once an individual is vaccinated, that does not give them the green light to go ahead and say, oh, now I'm immune. I can go outside without a mask. I don't need to follow the 5 commitments anymore. That's not the message. The message is you're vaccinated, you have a step towards your own safety. And we have no idea if that individual could pick up COVID and then transmit it to someone else, even if they don't have symptoms because they got the vaccine. Does that make sense?
Right, so that makes sense. I think what I'd heard before is that you definitely could transmit it to other people, even though you've had the vaccine. So I just wanted to be clear on that our message is that the vaccine is not an excuse or a reason to stop following the protocols.
Exactly.
With mask wearing. Yeah, thank you.
Exactly.
Just to clarify.
Yeah, there's still so much information that we don't know, and that will really be collected in real time as we go through this pandemic and people are vaccinated, and there'll be more information coming out, but at this point that holds true.
Great, thank you. I think if somebody else wants to pipe in, if I don't see you, please go ahead. I've got another question just for Jordana, just to be clear. We're concerned that we might be moved into the red by the state. And the question, I guess, is how precarious are we with Orange Plus right now? And I think what I'm hearing is that any modifications to it could be what pushes us over the edge with the state. And that's the other elephant in the room we're going to talk about. But I know by the end of today, what we have to have is a decision. I believe we have to have a decision on whether or not we are going to apply for and move toward Orange Plus, move toward the 5-star program, which is a long-term deal, a long-term being 4 to 5 or 6 weeks away. Is that correct?
Yes. So I think two separate things. So
right.
The decision on 5-star has no bearing on, our position in Orange Plus right now. So I think that the state has allowed us to stay in Orange Plus with our incidence rate, where it's at, because we are doing those measures above and beyond regular level orange.
And that's enough. And it's enough for now. Is that
that's enough? That's enough for now. Our understanding is still, if we stick with how things are now, we are still waiting for that additional indicator to flip into red, either our percent positivity rate or our hospitalizations. And if those, that are solidly in yellow right now, if they stay there, that we can remain in Orange Plus for the time being.
Got it. Okay, so regarding 5-star, before this day is out, do we need a vote on whether or not the board decides to move forward with 5-star?
Yes, that's the goal of the meeting today, is to give the public health department some direction as to whether we should continue to pursue, or whether we should pursue the 5-star program. And if we move to the next slide, I'm going to talk through the 5-star program. This is just a data summary stating the things that Greg really just brought to our attention. So even with the Orange Plus mitigation efforts, Picking County is one of the few counties in the state who has not seen that decline or even plateau of incidence rates. So this has really brought us to the attention of CDPHE, as well as our neighboring counties who did move to red and now have very similar incidence rates and positivity rates and hospitalizations to us, but they are still in that red level, and we are able to operate in Orange Plus. So we're really being brought to the attention there. And then just the statement that we know that the holiday and the winter season is upon us. People, we hope they will be, and we encourage them to only be congregating with their households, but that if they are doing that beyond just their households, we know that really increases the risk of transmission. So if we go to the next slide, we'll get into the 5-star program. So what is the 5-star program? It's a program that encourages businesses to implement safety measures beyond what's already required by the public health orders. The goal of it would be to help slow the spread of COVID-19, and then also the dual benefit of accelerate the reopening of businesses. The program is completely voluntary and serves as an expanding directory of establishments recognized for their efforts to keep their communities safe and open, because they're doing all of these additional efforts above and beyond what's required in the public health order. Public health agencies are being asked to achieve these demanding and historic objectives with their high burden of contact tracing, disease control, the new milestone of vaccine delivery. We really need to, as a public health department, make sure that we have the ability to maintain our pursuing of these primary prevention strategies, like vaccines, and that any efforts that we do on top of this, like the 5-star program, don't detract from these core functions that we know are going to have the biggest impact on COVID well into the future. The next slide helps us really talk through the framework. So what requirements does the county or city need to meet, the approval process to be able to get this program off the ground? And so we need to have a local public health agency director who meets the minimum qualifications. We have that. In order to launch the program, we also must apply for a variance from CDPHE. So what we know about variance applications is that we would need a supportive letter from our hospitals, our county commissioners who have already met on the 5-star program and given this a thumbs up. Also our county sheriff and some local police departments, mayors, emergency managers, and local tribes, but that's not applicable in our case. And so this is a step in the direction. So we would need to put together an application to apply for a variance, and those are some of the players we would need to have support this direction. Finally, the administrative committee who needs to be formed in order to apply for this 5-star program is what will be required to report weekly updates to LPA on how the county is doing with regards to certain metrics for the 5-star program. So how many new certifications were granted, which businesses received warnings, which businesses had their certifications revoked, and needs to actually do the enforcement. If enforcement doesn't happen, CDPHE will then remove the approval of the administrative committee and the 5-star program. The next slide works us through some more details on the program. So the eligibility really talks about when is a county able to apply for the program, and when are they able to get those benefits for certified businesses. So in the green level, yes, a county is eligible, but the same benefits are really already included into that protect our neighbor level. In the level blue, a county would be eligible for the program, and would the benefit to certified businesses would that they could have an additional 50 people added to their capacity. In level yellow, a county would also be eligible, and certified businesses could operate at the blue capacity levels. In orange, a county that was solidly in orange, meaning all 3 of their indicators were within the orange realm. A certified business in that circumstance would be able to operate at the yellow capacity levels. But as we saw earlier with our indicators, our incidence rate is in the red, so we would not be eligible at this time for the 5-star program. In the red level, a county could be eligible for the benefits for the businesses only if they have a 2-week sustained decline in incidence, percent positivity, and hospitalizations. And so if you think back to some of those other counties that were in red, who have been seeing the sustained decline for 2 weeks, a lot of those counties are really hoping to rapidly be able to apply for this program as they become eligible, as a way to get their certified businesses open to be able to operate at the orange capacity levels. However, some businesses will have some additional restrictions. For example, for seated dining, table distancing must be 10 feet apart, and they're only able to seat members of the same household together. So if you see that, those counties who are applying for this in red would still be operating at stricter levels under the 5-star program than we currently are in Orange Plus. And then in purple, that's the level when our hospital capacity is threatened. There's no eligibility for the program to occur.
Great, thanks, Jordana. Okay, so what we're looking at is maybe we would position ourselves to apply for this program, but we're 2 weeks out at the soonest. So that's not going to help us with the holiday season. Yet we still need to decide if we want to move in that direction. And the big question I have is, does your department have the bandwidth, or can you attain the bandwidth and the budget to pursue this increased scrutiny that this requires? And should we be moving in that direction?
So that would be, if we go to the next slide, we can, to answer your question, Greg, you're correct that we can always work towards, the question that we have for the board today, is this something that the board would want us to be working towards? Does the board support the concept of a 5-star program when we would indeed be eligible? Which would mean for us to be eligible, that our incidence rate would need to come back down and be solidly in that orange level. Right now, we are 3 times what the incidence rate limit is. Another great question that you have is, we would need to pursue additional staff to be able to operate this program, because it, as we talked through what the program entails, it's really going to be developing the program, designing it, having additional staff to be able to go out and certify businesses, respond to complaints. So there is a lot more involved in this program than our currently robust consumer protection program. So I think I've said all of these things on this slide. If we go to the next slide, these are, Greg, to your point, what are the steps that we can take to start setting up this program? So determine how the program is going to be administered. There needs to be an administrative committee that really oversees the program, of which public health is a required member. Determine what resources that we can devote to this program. And so the BOCC, I think, has approved additional staffing resources to be able to be devoted to this program. Greg, to your point, that we would need them to be able to pursue that. So that has been approved. Determine how you will ensure compliance and enforcement. That would be something that we would need to work through and see how that would work with our current consumer protection program. Begin preparing your application to CDPHE, and then begin preparing the application you would like your businesses to use. So each business who's interested in this would need to apply. If we look at the next slide, I think this is down to those 3 questions, Greg, to help walk through with the board, what's the direction for public health staff with regards to moving forward or not with building out this 5-star program in Pickens County.
Great, thanks, Jordana. We can have a discussion about this. When it comes to voting on this, do we need to take a formal vote on all 3 actions, or do we need just a thumbs up? And is this something that you can do through your as public health director? Is this something with your authority you can do without a formal vote? Just wondering.
Could I ask a question?
Yes, please, Brent.
It's Tom.
Oh, Tom, sorry.
2 questions. If I look at Andrew's figures today on the epidemiology, perhaps Josh could comment on this. We've had a gradual decline from 11.6 to 6.4% positive. I know that's a moving average, but I think that does show some progress. And are we taking that improvement into account? The second thing is that the the 5-star program describes there needs to be an enforcement. Can we have Sheriff Joe sign on to that?
Jordana, do you want to take the first one at least?
Sure, I know Josh is on here. So Josh.
Yeah, I can try to answer that. So Dr. Kurt, there we have included all of our asymptomatic testing into that figure. With that asymptomatic testing, we saw the positivity rate decline. Without the asymptomatic testing, the positivity rate wouldn't have changed much. It'd stay right around 10%. So really the asymptomatic testing that's been occurring in the county has driven that positivity rate down to where it is right now.
Maybe I'll take the second question.
Thanks, John.
And so I think one of the advantages that staff sees of potentially having a 5-star program is the enforcement mechanism actually becomes more administrative, Dr. Kurt. So the consequence of a business not complying with the requirements under the 5-star program is to lose their site-specific variance and their increased capacity. And that would be done administratively versus through citing a violation of the public health code. And so that would
fall under Kurt Dahl then for enforcement?
So that would be what we were talking about in terms of the need to expand our consumer protection program for those inspection and enforcement rules. And that's something that the board has expressed initial support to, Board of County Commissioners has expressed initial support to fund.
Now, John, before we go on to this, regarding these 3 questions, is this something we can do with a single vote? It sounds like the top bullet point, do we support the 5-star program, would necessarily include the other 2? I'm just trying to think of, in order to get through this.
Yeah, so there's actually probably only one question. It can really be direction to staff right now to pursue an application for the 5-star program. That application would need to be accompanied with an expression of support from the Board of Health for the county and local public health agency pursuing a 5-star program. So I think we'd need an official vote that you'd support applying for the program. The other questions are really to help guide and provide staff direction. And I do know there are some representatives, Greg, from ACRA that had talked about this. So just want to make sure we give them a chance to.
Great. Okay. So before we were to call a vote of the Board of Health, we want to include our representatives who've been invited. And I see Debbie Braun is on, and I think we've got Jimmy Yeager and Michael Goldberg as well as the 3 who we've invited. Debbie, would you like to weigh in on this? We take it to you.
Great. Good afternoon. I'm Debbie Braun, president of the Aspen Chamber. Thanks for allowing us time on the agenda. And also, thanks so much for the hard work over the last 8 months. I just want you all to know that it hasn't gone unnoticed and it's appreciated. So thank you. I'm really here just to give a business update on the 5-star program. ACRA hosted the initial 5-star program meeting in coordination with Pitkin County last week on December 8th. And we were hearing interest in the program from the local community. After the state released the program this last Monday, ACRA reconvened businesses with Pitkin County yesterday, and we had about 88 attendees. Pitkin County shared the 5-star program overview, similar to what they just did. And then additionally, there was some discussion surrounding the 10 p.m. curfew. I really just want to introduce Michael Goldberg, who is a restaurant representative on the chamber board, and he's just going to give you the business feedback of the 5-star program. And then I know Jimmy Yeager would like to address the 10 p.m. curfew. My one comment to all of you is ACRA wants to support and be a partner with Pitkin County and Public Health on the rollout and the execution of the 5-star program when that's appropriate. So just know that you have our support when needed. Michael, unmute yourself. I'm going to send it over to you for the business perspective on the program. Thank you.
Thank you, Debbie. I would like to speak of the allure of the 5-star program not just to the restaurant community, and that's my Matsuhisa hat, but I think from the business community as a whole, and I can speak to other elements through, for example, Belly Up, which has been closed since March. And in large measure, because we want to be a good partner on the public health side, not just on the business side. But our primary interest is in staying out of red. The 5-star program really gives us a path for that, because notwithstanding the ability to get a greater capacity if we meet certain requirements, there are certainly weighted advantages for the community as a whole, in my opinion, because there also is the protection of not being able to operate in red until such time as the metrics are in line with orange. And while we really appreciate all of the efforts of staying or of the reception of the Orange Plus program, which I think has been beneficial, I think when you look at the program, the specifics as businesses, there are a lot of elements of the 5-star program that are already incorporated by virtue of us being in Orange Plus. So I think there's the benefits of the businesses for increased capacity when the circumstances in the county provide that. So we're not trying to circumvent the safety elements of what you and we are trying to accomplish. The second is that the certification and compliance aspect gives us a real path and an enforceable path to the one word that I listen into these meetings weekly that I keep hearing, and that's enforcement. And so I think to John's point, because of the administrative structure of how 5-star is presented, we really have the ability to have some significant enforcement. Because as a business, I can tell you from my point of view, at least, the last thing I'd want to do is lose the certification for the optics, for the safety, and in the end, for the benefits that I have. And finally, this really is, from a business community, really our only path if we were to be forced into red. When I think about the idea of a tourist looking at Aspen and thinking of coming to town with no restaurants open, I think the allure, it's obvious that would be a detriment. And again, it's not just the restaurant community, but business as a whole. So I appreciate everything you've done as it relates to the Orange Plus and so on, and the opportunity to speak today. Thanks.
Great. Thanks, Michael. And Jimmy, we're going to come to you. I just want to point out that we had an hour total. And so I want to get through the 5-star because I know we want to talk about the issue around the curfews and last calls, things like that. And I want to make sure we have some time to discuss that before this is over. With that in mind, Jimmy, take it away.
Sure. Thank you, Greg, and everybody else. I'll try to be brief. I have about 2 or 3 minutes just to go through very quickly the rationale that we've discussed. So without further ado, the first point I'd like to make out is that we do have a mutual goal. The mutual goal is public safety, and that's shared by all entities, including our state. Specifically to Kim's point, that we need to take a very precautionary stance that will help us. The restaurant community feels that we can help with the following proposal. What we are recognizing is that the 10 p.m. curfew is a weak point in our mitigation strategy. As restaurant owners, we fully understand that a change in the 10 p.m. curfew is potentially viewed as an easing of restrictions. This is not the case, contrary to what many initial reactions are. We also understand that there's a fear, and it was made abundantly clear to me in a private phone call last night, that if we make a change in the public health order in reference to the 10 p.m. curfew, that the state may rescind our Orange Plus and move us into the red category. This also does not have to be the case. What we are identifying is an issue that as long as restaurants are allowed to operate for in-dining, then we have a solution to this weak point, and therefore we can offer a greater level of safety for us and our guests. So I'm suggesting that it's how we present to the state the rationale that changing the curfew is not a loosening of restrictions, but instead an added safeguard to our mitigation plus strategy. The purpose of the pre-Thanksgiving offering of the curfew was generated from the belief that limiting our business hours and having guests leave by 10 would be useful. Our experience as restaurant owners collectively is showing us otherwise. And after a month of the curfew, we are here to inform the board that it is doing actually the opposite. Our experience is showing us that for several reasons, the unintended consequences of the curfew is hampering our ability to provide the safest environment for our guests and our staff. In order to successfully comply with our 25% capacity restrictions and survive with the least amount of loss, restaurants are being forced to operate under conditions that result in our guests having to limit their dining experience, and in doing so, unintentionally creating a gray area of keeping everyone well spaced when entering and exiting the restaurants, as well as the difficulty in managing the turning of tables and a forced exodus from multiple residents at the same time at 10 p.m. That unfortunately is leading to too many people gathering, albeit it's outdoors, while waiting for transportation back to their homes or to their hotels, etc. Our goal is to keep people physically spaced. One way or the other, we will make it work. We are committed to that as a restaurant community, as our intention is to stay open. And we do appreciate everyone's support in us staying open. Please keep in mind that as well as others in the business community, we are being asked and restricted to earn our livings by state order. And we receive no current compensation for that. We are being required and asked to be part of the solution at our own expense. We are willing participants, but it doesn't mean that it's easy. We do concede and agree that limiting service of alcohol is an issue, and even further recommend the entry of new guests should be limited to a time prior to 10 p.m. What we are arguing is that we are not arguing that a last call to curb intoxicated behavior later in the evening is not unwarranted. We agree with the last call. We concede that uncontrolled continued serving of alcohol may cause a deterioration in compliance. Given that circumstance, the state's 10 p.m. last call or slightly earlier is acceptable to the restaurant community. Another issue to be considered is the fact that there is no restriction on off-premise selling of alcohol after 10 p.m. What this does is it promotes informal gatherings at hotels and private homes. This is what we're trying to avoid from what the epidemiologists are telling us. Isn't it better to keep guests in a regulated, spaced environment? We think so. How we present the rationale is very important. We are restaurants and we operate as sit-down table service establishments. Allowing a longer service time can only be advantageous to our mutual goal of providing a safe environment. We have proven our willingness to be part of the solution, and we ask for your trust by extending the hours of our operation because we know that it will provide a safer environment. We know that spacing out our guests will result in an easing of congestion. It will allow for us to utilize other tables for table turns. There's a whole lot of things that it will do. The other thing is, and finally, it's been made perfectly clear that the state views their statistical success of moving certain counties into the red has made a difference in the metrics. We get that. So with the understanding that the state may be even more motivated to push in that direction, it is incumbent upon us to present this change as a positive in our mitigation strategy, despite their predisposed position that less is better. We are not apples to apples with other counties, and it appears to be our job to continue to work with the state for them to understand that we are employing the best mitigation for our unique valley. I'm going to leave it there just for brevity, but please, if anybody has any questions as to why we feel that extended hours is actually the better course of action and it's in everyone's best interest of safety, please, we'd like to field those questions so we can get, the 5-star program is wonderful, but it's 4 to 6 weeks away. We really need to have an action plan that helps our mitigation strategy today and for the next 2 weeks. Especially for the next 2 weeks. I'm proposing a change in the public health order, and I think that we can communicate it to the state as a benefit and not as a loosening.
Thanks, Jimmy. I want to bring us back around. I appreciate that, and we're going to try to get back to that as soon as we can. I want to make sure we get the business of the day taken care of. First, can we bring this back with a question? John, is there anything else you or Jordana want to add to this before we actually call a question to our board?
On the 5-star program, no,
On the
unless, yeah, unless there are questions from board members.
If so, Ann, I see a question from Ann. I see a question from Tori.
So just to look into the 5-star program, we have to add, I understand you have to add staff if we end up achieving that program, but just to be looking into it in the next 2 weeks, will you have to add staff?
So, Jordan, I don't know if you're looking for your mute button, but you know, part of the process is there are a number of stakeholders that would have to support a 5-star application. So that includes the hospitals. We would have to have those conversations with municipalities. This conversation is with local public health agencies. So, you know, the process is set up for a lot of stakeholder discussion. So I think a lot of that could move forward, you know, initially to prepare an application. So, yeah.
I think the answer was yes, right? Yeah, we do need to start now.
And so I think that process, you know, could start, but that we would look to, as soon as possible, be hiring staff. You know, I think that the fidelity with which we've, you know, had our current business safety plans and event safety plans and consumer protection program would set us up for success to ultimately be approved if we were to get the buy-in from the community. And so all of that work to redesign our systems to comply with this plan is also the work that we would need to staff up in order to do.
Okay, thank you very much.
Tori, did you have a question on that, or do you want to make a motion?
No, I have a few questions that I would throw out there first. Number one, I was going to ask that Josh maybe explain a little bit more how it's relative about the asymptomatic tests and bringing the positivity rate down, and what does he mean, and what does that indicate to him? What is he saying by that? That was number one. Number two, I think that there needs to be more discussion about this 5-star program and the bullet point number 3, which was the administrative setup. I appreciate the fact that we're asking
I don't want to miss this. It's very interesting.
Miss it if you're gonna go.
More. I appreciate that we're asking for more staffing for enforcement and compliance, but that's exactly the problem that we're having right now. You know, I don't know. I'd love to hear more about that. Like, and maybe a pro and con here on a 5-star program. I feel like we've been doing a lot of stuff above and beyond, obviously, the Orange Plus restrictions, but are those being followed, and are we being successful in what we're doing? So this next program, it sounds to me a lot of like what we're doing, and I'm just wondering if this is there a real pro to this that keeps us acting on health and safety, that keeps us open and successful? I'm not hearing that it's much different than what we've been doing, and it sounds like a lot of work. And I would hate to get a month down the road from now to be instituting something that is really just what we're doing by another name. What's the big benefit of the 5-star program is that you have the ability to go to a business that's not complying and pull their certification. Well, can't we do that already? So I'm having a little bit of difficulty. I'm supportive of what the intention here is, but I just don't know. I just don't hear it as something that's really great for the amount of effort and work that we seem to already be putting into a lot of these. So I'm a little still confused by it. And I'll just share with you, to me, this is the same confusion that I've gotten from a lot of the state started programs. You know, when we switched to a state dial, that didn't really make sense to me. When the state changed their dial, that didn't make sense to me. So once again, seems like a state program where I really just, I get the intent, but I'm struggling with the application of this.
Kurt, did you have, or Tom, excuse me, Tom, did you have a question?
Yes, I specifically want to say I feel just as Tori, and I think that he worded it very well. This has to be better explained in the justification for it. And if the restaurants want to stay open, as they have suggested on the other matter, I would like to see that they're actually keeping their kitchens open and serving food and not just pretzels. There has to be a sincere effort of serving food and not just the pretzel and the potato chip in.
Got it. Jimmy, I see your hand is up, but I want to make sure my board has a chance to weigh in here because we are running out of time on this, and I don't know how much longer anyone can go beyond 3. I think we're supposed to. It may be that we just don't reach a decision on the 5-star program today, and if that's the board's decision, that's fine. But I want to make sure I've heard from, Brent or Linda if you're with us, and whoever else I haven't called yet. Krista, I see you're here. There's Jeannie. Jeannie, go ahead.
I have a question about restaurants and whether, like, where is the transmission happening? Is it happening between wait staff or between customers? So I just wonder if someone could comment about that source of infection.
That'd be Josh.
Yes, yeah, Jeannie, I think the transmission that we've documented and that we've seen, it has been primarily between employee to employee at the restaurant. We've seen several different cases, where it has transmitted there in that space between different types of employees. So it's not always server to server or cook to cook, but we've seen it transpire in other ways as well. So documenting, customers that are at restaurants is really hard to identify. We have a few instances where we think that likely happened, but it's very hard to quantify and determine when a customer at a restaurant has truly been exposed there. So that piece is harder to identify.
Thanks, Josh. Jordan, I want to bring this back to you and to John very quickly. Just we've got 5 minutes left before 3 o'clock. Are we going to try to have a yes or no vote on implementation of the 5-star? Is that essential? Is that the essential task for today?
That is what we posted the meeting for. Greg, I don't know if you want to poll the board to see if there's a little bit more time for the conversation. I do think Dr. Kurt and Tori raised questions for staff that we should probably answer.
Are you talking about trying to answer those, not during this meeting, but what that would mean is a delay before we were to vote on this? Is that correct?
Greg, I think we need to hold the vote too, because I feel like a lot of us still have questions, and this doesn't seem incredibly urgent right now, where it does seem we have other matters that are incredibly urgent.
So you're suggesting we hold the vote so we can either table this and come back to it, or you're saying just vote for it right now? What were I didn't catch your suggestion.
My suggestion was to table it.
And Greg, the other question would be, is there any additional time that board members would be able to stay on now, and the staff could answer those questions and get into it for a little bit more, so the board would.
Can I see a nods of heads, thumbs up if you can stick around? Jeannie's got a yes, Ann's yes, Tom's got a yes on that, Krista yes. Okay, we're gonna keep going here. Thank you. So this is our opportunity to answer these questions. I think Tori had some good questions, as did Tom. I'd love to hear, let's see how far we can take this.
And Brian leads our consumer protection team currently, and has done an analysis of the differences between our current plan and the consumer, our current consumer protection business safety plan, as well as the 5-star program. And so Brian, if that's all right, I might ask you to be able to answer what some of those differences are as to the programs.
Yeah, I can certainly do that. If there's anything specific we're looking for, or I'll need to pull up that.
Yeah, if you could pull up the document. I think Tori's question was, how is this different from what we're currently doing? And then what are those benefits? And so while Brian's pulling up that document and he can share it, I think the question is, Brian will answer, how is this different? We are requiring a lot of the things already in the 5-star program. What is different? I think the main benefit that is different is if you do comply with the 5-star requirements and we are in an eligible zone, then you can operate at additional capacity for those businesses. So that would be, I think, the main benefit difference.
Exactly, yeah. And that really will affect mostly the restaurant industries, personal services, and gyms. The differences in capacities don't really change much for any of the other sectors.
On the enforcement side too, I think it does give us a little bit more tiered response than we have now. And so for businesses that are out of compliance with those 5-star requirements, you have a tier of going down in capacity levels before we have a cease and desist order. So, right now, we have a warning process, and then we've got a shutdown process, and we go to court. And that is very, very time intensive, it's labor intensive, and it is a very, very significant hit to a business that causes, from an enforcement perspective, you're really weighing how significant an infraction it is. And I think the one of the goals of the 5-star, one of the advantages of the 5-star program is you can remove those additional capacity requirements before you go to that cease and desist and court process. And it's something that can happen quicker. So I think the advantage on the public health side is that nuance on the enforcement, Tori, and then the advantage to the businesses is as Brian and Jordana were describing.
Okay, thank you, John. Other questions from my board regarding this, Dr. Kurt?
If we approve this, are we locked into it? And if so, how long does it take to get out?
We could discontinue the program really at any time. And if we were to administer the program poorly, we could also have it taken away from us.
Right. Okay, that answers that. Other questions from my board?
Well, this is Brent. Can you hear me?
I can hear you. Go ahead, Brent.
Yeah. I just wanted to say, first off, I feel similarly to Tori in terms of the kind of confused presentation, and I know for sure that the public is infinitely more confused, I think, than we are sometimes because of the unclear way some of these things were rolled out. My personal feeling would be that this 5-star program sounds like progress. I think we're all trying to come to the right conclusion. So that in a certain sense, there's no bad choice because we're all trying to do the right thing. Even if it's a little obscure. And then thirdly, my feeling is that keeping things open, restaurants and so forth, a little longer, and I fully get that argument, and it's kind of a tormenting one, but it does seem to be a little less restrictive, which again, maybe is not so good because of the fact of the infection rate being so high. At the very least, right, it tells us that the pool of infection out there is much greater, unless I'm misspeaking, but much greater than it was before. So if it was dangerous before, it's even more dangerous now. And I think we have to kind of include all of that thinking in whatever choice we make. Thanks.
Yeah,
thanks, Brent.
I was just gonna say, yeah, the state of Colorado currently is saying that 1 in 40 Coloradans are currently infectious with COVID-19. So that would mean that obviously if you had 40 people in your restaurant, there's a very good chance that one of them would be contagious with the virus. And somewhere between 20 to 50% of the cases are asymptomatic, that they would not know that they are contagious unless they tested.
Thanks, Brian. It occurs to me that what we really have are a couple of bad choices. We've got to choose between them. It's not like we're going to find a silver bullet here. The 5-star may be the iceberg we're trying to step onto to move forward. And if I could, I'd love to see if I can call the question here, if I can get someone to make a motion regarding moving forward on the 5-star. And we can certainly discuss it further. I see a couple hands up, some other things people want to say. Jeannie and Chris, I can't see you, so I don't know if you're nodding your heads or not. But I'm not sure we can really stand still and we can't move backward. And I don't know what the alternative is. If we decide not to do this, then we're going to wait until the state moves us into red, I assume.
I feel like if the county supports us, sorry. If the public health supports us and wants us, I'm in support. I don't feel like I fully understand, again, if we're going to cause people to do a lot of work and have to hire a lot of extra staff. But if it's something that's going to be beneficial and help move our county in the right direction, it's in my full support.
And then Greg, I just want to that last statement that you made. I don't think that that's the choice.
Okay.
So
Correct me, please.
The choice is, the 5-star program, we would not, our businesses would not be eligible to receive any of these benefits until we were solidly in the orange level, which means our incident rate is coming way down. So that is weeks away, maybe months. I mean, it's difficult to tell if we continue where we're at, how long that's going to take. So, the choice I think is this a program that the Board of Health would like us to pursue starting now? If we make the choice, yes, we will continue to pursue it. We will get staff on board. We will work with the committee to set it up so that when our incidence rate comes back down and we're eligible to have those benefits, we can put it into practice. If the board votes, if the board says that's so far away, we don't want to support it at this time, it does not mean that we couldn't pursue it at a later date in time. Okay. So I also, and John maybe wants to jump in there, but I just, there's no limit right now to when you can apply. We can apply, but the benefits won't be eligible, effective until we are within that realm of the data.
Right. That's why we realize we are weeks away. John?
Yeah, and we also don't want to be in a position though where our data starts moving and then this becomes a fire drill. So we're trying to get this in front of the Board of Health early in terms of actually giving us some time to work on something during COVID would be awesome. If the board were inclined to pursue such a program. And, I think the question has come up, in the ACRA meeting and past meetings, is there a downside right now to exploring this and really outside of the time and effort, if there's not going to be any support from the board to actually implement it, there's probably not. It'd be if the board is inclined to pursue it, it's better for us to have time to lay the groundwork now when we're not, we're in crunch time all the time, but to have more time to prepare an application and do the work that we need to do, build a program and build the capacity. It's better to get that direction early than to do a fire drill saying, why can't we do it next week? So I just throw that in there.
So the reason we would go forward with this is to buy enough time so that our staff could actually handle taking it on. But we realize this is down the road. So it's not the immediate problem. So I think we realize that now. Tori?
Great. So for John or Jordana, so then can you just speak to the alternative? The 5-star program is one alternative. If we were not to do that, then we kind of stay on course as we're doing. We seek for ways to bring our incident rates down. We seek to get into lower level categories before we make any other moves.
And then, yes. And
All
then
right. All right, I think I have a little better understanding, and I appreciate that. Greg, I'd make a motion if you want to get this for further discussion and for direction. The motion.
Okay.
I'll just put this out there so we can have a vote on this, and we can have some further discussion if we like. I'd make the motion that upon approval of the motion, the Pickens County Health staff and county staff would be working on preparing the application for the 5-star program. Is that how it would be worded, John or Jordana? Is that the go ahead that you're seeking? Okay.
That works. We have a motion. I need a second. And if
I'll second it.
I've got Jeannie has a second. Tom has his hand up. Further discussion, Tom, or I've got
The second, in the nature that Tori explained, we're administratively preparing for the implementation.
a motion and a second. Correct. Okay, I'm going to call that question because I think we need to move on. All in favor, give me a hand up, right hand up, thumbs up.
This is Brent.
Okay. Sorry, Brent. I didn't see you, Brent, but I heard you say something. Was that a yes? We may have lost him, but we have enough to pass this, okay? So far, it looks like we have a consensus.
Whoop. Sorry.
Brent, was that a yes?
Is that better now? Yeah, I vote yes.
Okay, thank you. All right, passed, and we're moving on. I want to frame up the elephant in the room, as we've called it, is regarding the extending the closure and curfews and last calls for restaurants. I did want to read to you very quickly. I'm just going to express this. The sentiments, at least, our board has not been in full agreement on the relaxation that we talked about even last week when the Board of Health moved toward going to groups, 10, 2 households up to the size of 10. I know Kelly had severe misgivings about that and still does, and I want to express those on her behalf, that we have not had complete agreement on our own board, the Board of County Commissioners, regarding that. So I want to keep that in mind as we move forward. As we start talking about relaxing restrictions, I know we've got hands up, and I also know we had many comments from people who are concerned that this might be the straw that breaks the camel's back regarding the state moving us into red. So to frame up that conversation, I think that if I summarize that conversation, is that we're afraid of being pushed into red sooner if we relax our restrictions. I know Jimmy and some of the restaurants certainly have a problem with that. But I think that the suggestion we have is before making a final decision on that, it would be really great to understand how the CDPHE would respond if we were to loosen our Orange Plus. And so I'm going to offer that we ask our public health director, Jordana, to make that entree to the CDPHE before we decide what we're going to do regarding loosening restrictions. And I'm talking about just extending hours, because that's how it's being seen. And there's a certain amount of fear in the community that this could be what pushes us into the red. So if I could frame it up that way, that was understandable. Do you need to describe, explain this anymore, Jordana or John, before we open it up?
Move what you have suggested, Greg, implementing it and see how it could be implemented with the CDPHE and seeing what circumstances under which that could function, such the kitchens need to be open, not just serving pretzels or dessert during that period of time, people eating, not just drinking.
So Tom, you're making a motion that we authorize the staff to consult and confirm with CDPHE before we move forward. Is that?
That's correct.
Okay, I'll
Greg,
take that as
I'll the opportunity just to clarify a couple things that have been asked.
Sure, Jimmy, go ahead.
Please. Thank you very much. Tom, to your point, you're exactly right on. It has to be, what we are asking for is not extended hours of food service. We are not looking to add new customers after any time prior to 10 p.m. What we are looking for is to allow our guests to finish their meals later into the evening past 10, past the alcohol cutoff. I fully understand that it's a slippery slope of having a nightclub present itself as a restaurant. That's not what we're talking about. We're talking about the restaurant community being allowed to let their customers continue enjoying their dinner later into the evening after the alcohol cutoff. In addition to that, to Brent's point, that the perception of this could be an easing. I really want to be clear about this. We do not view it as an easing. We view this as a weak point in our mitigation strategy of plus. As a matter of fact, if anything, we've already added the affidavit to our program in the county. If anything, that is far more restrictive than any other county is doing and could be a way to rationalize with the state that we've already added something more restrictive. So even if they view a later allowance of us operating, not taking new customers, but operating, then the affidavit may balance that out if their perception is that it's easing.
Great.
Okay.
Thanks, Jimmy. Thank you for clarifying. That does make it clearer. And I think the motion.
Sorry, the only other last thing, really, I'm unapologetic to needing your time. This is not something that 10 minutes is going to conquer. It will enhance compliance of restaurants without a curfew. Right now, what you will see is an increase of non-compliance by bad actors in our sector if they are not allowed the leeway to keep people well spaced. It is going against everything that our county is trying to do by forcing business to operate in a 4 to 5 hour window. If you want compliance, take it from us that are on the ground in the restaurants. This is a methodology to help with compliance, to help with safety. I understand that it's easy to perceive it as loosening. It is not. Okay.
Thanks, Jimmy. Tori, I'll call on you, and I want to make sure we reframe what I said that Tom made as a motion. So go ahead.
Yeah, I just want clarification about process here. So I guess my understanding was Orange Plus are our county's regulations, and some of these stipulations are in this curfew discussion fits in those regulations, but we have to take this to the CDPHE.
The motion as it is rather than our board deciding right now, which I think makes some people pretty nervous, that the motion would be to authorize the staff to charge public health or change the public health order only after consultation and confirmation with the state, that change would not push us closer to the red or into the red.
Greg,
So who's that? Sorry.
can I ask a question of the board?
Please.
Just wondering what the board members' opinions are about the proposal to examine curfew. From where I'm just curious where board members are sitting in terms of their opinions on whether we should keep our Orange Plus measures in place, or if there is interest in examining the relaxation of that.
Well, thank you, Jordana. That's great. I'll poll our board right now. I think Dr. Kurt has weighed in. What do we have from the rest of our board? I'm looking for Jeannie and Krista and Bill and anything else, Tori.
I'm just wondering if there's any data on whether curfews affect transmission rates. So, but I would hate to see our county go into the red. And I would like to have Jordana talk to CDPHE and see whether this discussion would force us to go into the red.
Well, on that note, Jeannie, would you support Tom and his motion that we charge the public health director to reach out to CDPHE
Yes, I would.
regarding that?
I would.
Okay, so I've got Jeannie on You could make that a second, and then we just have further discussion and then vote if that's what you're willing to do.
That's fine. Yes.
Okay, so I have I don't want to be twisting people's arms here, but we have a motion and we have a second, and I'm going to articulate it once more. I have it written here. And the motion would be to authorize staff to change the public health order only after consultation and confirmation with CDPHE to approve that change, and it does not put us in the risk of moving into the red. I'd love to hear, we could put it to a vote now, but I'd love to open it up for conversation while we have the board here. Tori.
Well, Jimmy brought up another interesting statement about the last serving alcohol. Last call would either be at 9:30 or 10. We haven't settled in on that. Jimmy also alluded to something about not necessarily new customers after 10 p.m. or something to that nature. I'm just wondering about those, how those are going to work into this. I'll tell you, my feeling on this is I think the biggest benefit from this is that it actually does probably prevent more informal gatherings. I think giving people the opportunity to be in a safe, controlled environment, safest and controlled environment, I think actually is one thing that I see from this that actually makes sense to me. There's some other parts of this that I don't think are necessarily going to be very impactful, but that one, I do see that this could be benefit there. For benefit of discussion, City Council is also split on this as well. It is not unanimous on support for this. So my big question though was really about last call time and the suggestion of I don't want to preclude people from going somewhere. I don't know. The last call time I think is important for this as well. And if what we're doing is having them start a conversation with CDPHE, I can support that, I suppose.
Thank you. Anne?
Sorry, it took me a sec to find it. Yeah, I'm one of the council members that does support this. I think Jimmy makes a good case for it, keeping people in a safe environment until 11, and then chances are, more chances that people will just go home after that as opposed to leaving at 10 to go find another place to gather. I think it'd be important that liquor last call is at 9:30. And then the point of not allowing, admitting additional guests. The thing that really concerns me to have this contingent on Jordana talking to the state is I'm not sure they can give you any kind of guarantee like that. And I don't, not that I don't trust them, but I wouldn't trust that if they said, sure, Jordana, go ahead with that. We won't move you into the red. And then we did it, we got moved into the red. So it's, we had a meeting earlier today that Greg and I were part of, and it was basically measuring the risk against the benefit. And I think that's what we're dealing with here, is the risk we're taking worth the benefit to the restaurants. And I'm assuming that Jimmy, you and Michael would not have brought this up and supported it if it wasn't something that would benefit your businesses. All that said, I do think it's a good idea, but I'm not quite sure how we proceed with the state on this.
I think what we're doing, Ann, is trying to hedge our bet here by not making a yes or no decision right now, because it's a little scary. We're trying to feel out the CDPHE, I think is how I would frame what we're trying to do. So it's a matter of just trying to assess the risk a little bit more before we commit. Because if we commit to making an extension and that bumps us into red in the next few days, there we are. It's possible that, we can glean some information and figure out how to make this work if we charge the public health director to do that. So that, I think that's the point of this, rather than putting it to a vote right now. It is a bit of, we're hedging our bets. It's, in principle, there are pros and cons. Let's see what we can negotiate with CDPHE based on the best data and science they have. And it's an uphill swim. looking at all those charts from the other counties, I'd have to say it seems like an uphill struggle, but we can certainly try, and we should try on behalf of our business community. Tom?
I would propose an amendment of having Tory sit with Jordana in a three-way with the state. So Tory, I think, is a little bit more forcefully going to express how this might be implemented and would help a three-way call would help clarify these matters.
Okay, that's an amendment to your motion. I want to make sure that that flies. I'm looking at John and I'm looking at Jordana. Tori didn't really volunteer for that. So I know we would probably have other people involved as necessary. John.
Typically, you would have a chair or vice chair playing that role unless there's a specific reason. If it's a little unusual, but it'd be fine.
I'm available to support Jordana and everybody on this team as much as I can. So if that's a move for support, I'm all for it. I do not want to get in and sticky up or monkey up anything. So, I'm all for playing a role that is supportive. That's for sure. I'm looking at the chat here. I'm noticing a comment that does talk about state orange level being 10 p.m. is last call and no curfew in the state orange. So we still, even with an amendment to these times, we are still at an orange plus, if you will. It is still more, it would still be more stringent than state orange level.
So that is correct. I think what the board needs to understand and how CDPHE might look at this is one, our incidence rate data is now worse than most counties that are in the red with that metric. And so I know the state's getting a lot of pressure there. If you look at the epi data that Jordana presented from the state, I think the state in our conversations has been looking at it. They're saying, well, we do know what works to bend the epi curve, and that is the level red restrictions. Third, we went into our orange plus in lieu of going into the red. I think it's important to understand that under the state's public health order, they can move any county into the red with one metric that's been in the red for 14 days. Their practice has been to have a consultation with counties and either go into mitigation or go into the red. We chose mitigation. We presented orange plus. It was after consultation, wasn't done in a vacuum. And so that's why we think this conversation with CDPHE is important, because if they see our incidence rates have more than doubled over the last month. And so I think we need to, I do feel like we're on thin ice with CDPHE and movement within the dial. And that's why consultation, understanding how this is going to be perceived and what subsequent actions the state might look at is really important.
If I may, with all due respect, I think you're overcomplicating all of this. I think that, of course, it's just a matter of course that you would have to call the CDPHE and say, we're considering this move because we think it's a weak point in our mitigation. We want to be better. What do you think? If we align with the orange for state in this one category, we think it's better. What do you think? If they go, we think that might be better, then the board takes a vote and we go for it. I don't think there's any risk to having a conversation with the state. I think people are making it up in their heads that it's risky to talk about it. We've already had the conversations about what Orange Plus does. We've added the affidavit. I'm sorry for taking time, but I really think that this is a far simpler process and has to be done quickly with the CDPHE. just to inquire about, this is what we're thinking about. We haven't made any change to our public health order yet. We're not going to do that unless we know that it's not going to put us into red. First and foremost, nobody wants us to go to red. We don't want to go there. We don't want to take that risk, and we don't want to put anyone else in that position either. We think we've identified a weak point in our mitigation. We think it needs to be changed. We are presenting you a case for that. We think it's simpler just to have a conversation with the state about it and get their impression. And if their impression is, okay, you've already added affidavit, that makes you even tighter than you were before. Let's try something that might actually help.
Okay, Jimmy, we got it. Thank you.
Fine. I'm off.
And just to offer the public health perspective as well, Jimmy, I hear your reasoning for how you're saying that extending, going back to the level orange would, how you're arguing that that would be more protective. I think why we added it as a mitigation strategy is because, there's varying research, but the research shows that a curfew can be protective and help us bring down that incident rate. So I think it's also this opinion that we want to hear from the board is, by saying we want to remove the curfew as it is now, the board is saying that we think that, like, I just want the board to be thinking about what is the protective mitigation strategy that the board wants to support in making that decision of what we think is going to keep us in Orange Plus and out of red.
Great. Thanks, Jordana, for summing that up. So what our board is deciding right now is whether we change the curfew or not. And if we do, it would be a motion to authorize staff to broach the subject with CDPHE before deciding to go forward. That's the motion. And I think we had an amendment about adding Tory. I think I'd prefer that you remove that amendment, Tom, although that's still an option.
I removed the amendment.
Great. Okay, but it's a good point.
And it's clear that we're authorizing staff to negotiate with CDPHE, not just yes or no, but different parameters. So you have a choice of A, B, C, or D, not just yes or no.
Right. So really that puts it on Jordana to reach out and see if we can find where the flexibility is, if there is any, and what the danger is of being pushed into red. Jeannie, I need an amendment of your second in order for that to give me a thumbs up or and unmute and tell me. Okay, so Jeannie's got a set. We've got a second from Jeannie. We want to continue talking about this, or do you want me to call the question? Any other questions on this? I'm going to look for those who are blacked out. Let's see whether it's Brent or Krista. Anyone, nothing else to add to this? Okay, I'm going to.
Greg, could you clarify who made the motion initially and who seconded it?
Tom Kurt made the motion and Jeannie Siebold seconded it. And thank you for keeping track of that for us. And then I did see a hand up. Somebody had a hand up for a further comment. I don't see it now. So I'm going to call the question. All in favor, say aye. And give me a thumbs up.
Aye.
Okay, I see. And then I'm going to look for nays also. Any opposed?
Greg, this is Brent. Could you restate the question?
Sure, I'll give it a shot. Now, before we go any further, I will restate it, but I wanted to make sure. Ann, was that a not voting or, oh, you're an alternate, right? No wonder. Okay, you're an alternate. Thank you. Didn't see your hand go. This is a motion for the Board of Health to authorize the staff to change the public health order only after consultation and confirmation with state CDPHE to see if they would approve of a change like that. So we're not making the decision to move right now with changing the curfew. We're authorizing staff to consult CDPHE and then make the call. Did that answer your question?
Very good. Yeah, it did. Thank you. And I would certainly vote for that. I just with a caveat, not something that stops me from voting, but just that the whole exercise of all these games we've been playing, and I mean serious games, is to keep people away from each other for as long as we can. I mean, that's the essence of isolation, and anything that breaks that down, you're right, gets problematic. And it's so difficult to know that if you stop drinking at 8 o'clock, what effect would that have? Or at 9 o'clock or at 10 o'clock? I don't know that we have great metrics on all of that, because the overall philosophy is, again, stay as distanced as you can for as long as you can. So I'm always hesitant to go backwards if that's what this is, but nonetheless, I vote for it.
Okay, so that's a yes. I think we have consensus, certainly. I didn't see any nay votes. So that's closed. We voted on that. So that's the way forward. Tori, I see you talking, but I didn't, you're muted. Still muted, Tori. Am I off now?
I'm not sure Tori was trying to get on.
Oh,
right?
okay. All right. Further business, Jordana. I think we've done what we came to do today. We've made passed 2 motions. We know our way forward regarding investigation of 5-star. We know our way forward regarding relaxation of a curfew cautiously, only after consult with the CDPHE, and we've authorized you to do that on our behalf. Okay. Any further business that I need to conduct here this afternoon? Thank you all for going over.
We do have to circle back and just vote and approve the last meeting minutes from December 10th. It'll be 30 seconds, but I just need a motion in second.
So moved.
Thank you. Okay, we've got a motion. We have a second. Approval of the minutes. Don't everybody rush.
Second.
Okay, we've got a second was from Bill. That's all in favor. All right, okay. Unanimous approval of the minutes. Thank you. Thanks for is that Lindsay or Suzuho, who I can't see who it was, but thank you for bringing that up. All right, with that, do I need a motion to adjourn?
I move to adjourn and announce the date of the next meeting.
Somebody's going to be the next meeting. We have January 14th is our next meeting, 1 to 3:30 p.m. So that means have a great holiday, everyone. Thank you for your work and attention to this. I need a second. Okay, I've got a second from Bill. All right, all in favor, thumbs up, and we'll be adjourned. Thank you all. All right, thanks for doing the brain damage with us today. Mark, you'll be back next time.
Thank you, everybody. Happy holidays.
Thank you. Thanks, Jimmy. Thanks, Michael, for coming, and Debbie and everyone else. Thank you, Jordana.